So I'm going to be talking very quickly here about treatments. This is to give you an overview before you actually start working with children. And again, I hope one of the things, and we'll have a chance to have a little bit of a discussion in a week or so once people have gone out, is to get a sense of just the tremendous variability. And I hope you get, this will make more sense once you've actually worked with some of the children, adolescents, and young adults, to get a sense of just the tremendous range, both within the child and between children. So I want to say a little bit about history of interventions, understand what may be some changes actually for the positive and outcome with intervention. I'm going to say a little bit about the kinds of programs that are used and some of the new strategies, resources, and challenges. If you go back to look historically, remember Connor described autism in the 1940s, 1943. Intervention programs really started in the 1950s, including literally here. I mean, here at the Child Studies Center in the early 50s. The first models of intervention were so-called psychodynamic models, treatment models that revolved around presumably fixing up some defect in the parent-child relationship, which was thought to somehow cause autism. The bad part of this was it blamed parents for causing their kids troubles, and we know that that's really not true. Probably a minority of students with autism in particular, probably about 20%, actually went to school. It was quite possible for parents to arrive at school with a very disabled child and to be told, we can't possibly take care of your child. And the parents might then say, well, what are we supposed to do? And the school might say, put them in a residential treatment place. And there were, in fact, places here in Connecticut, several state schools for the mentally retarded, what was then called the mentally retarded. And children went there and they stayed there. And one of the things that we've actually learned about living in institutional settings is it helps you learn to live in institutional settings. And so that's where the children tended to stay. The big watershed in this country came in 1975 with Public Law 94-142, which mandated for every child in this country, starting at age 3, education as a right. Schools could no longer refuse to educate students. Big difference. I mean, there are other important laws, and again, if you read in the book, you'll read about the Disabilities Act, the ADA, but this Public Law 94-142 really marked a change. And for the first time, we're starting to see children get intervention. Now, I do want to emphasize, and people should have seen online, there's a bibliography, including an annotated bibliography. There's a nice chapter for anybody who's really interested in this by a woman named Pat Hallen, who's in England, who does an overview of all the outcome studies up through 2005. And she talks about some of the problems in interpreting the outcome studies, and there are some issues. There are differences in methods. We've changed the ways we diagnose autism, so there's some complications. That being said, in general, the trend looks like it's been towards better outcome. I'm going to show you some slides in a second to say there's better adult outcome. Those of you working at Chapel Haven, this is a new population in some ways, which is great. People who are on the verge of being able to make it independently, go to college and live independently. That's wonderful news. We have more children with autism who have language, not just autism spectrum, but the more classical autism. More children with autism can talk. They also seem to be doing better overall in terms of their IQ and outcome. Now, there are some issues interpreting this research, and I present it with some words of caution, and especially when we talk about normal or good outcome, or what sometimes parents will say, oh, my child is cured. My experience, having seen thousands upon thousands, literally somewhere probably between 6,000 and 10,000 children on the autism spectrum, I have met a handful that if I met them, I would say, geez, I didn't realize that the child had something wrong with them. A handful. That's not to say it doesn't happen, it does. Most of the time, when you see a child who's done very well, some form of social oddity remains. And again, you can decide what normal is. And you can have a big debate about that. But if you mean living independently and self-sufficient, I'll settle for that. That's great. Again, there's some problems interpreting the research, the early confusion, autism and schizophrenia. People didn't know who was being studied. We've changed the criteria over time. We've also changed intervention practices. So we have this Public Law 94-142, what's called the IDEA, which we'll come back to talk about when we talk about mandates for services, better detection. When I first got into this business in 1980, I came here to work with a man named Donald Cohen. People didn't know what the word autism meant. If they said, why did you go to Yale? I said, I'm interested in children with autism. They said, oh, we need more artistic children. People thought it meant childhood artists. So it's a very different time. And there are issues in terms of definitions and quantifying treatment. That being said, I want to show you some things about outcome. And I'm going to use, again, this is quick and dirty, but it's effective. Good, fair, and poor outcome. Good means you're living pretty much by yourself. Fair means you need some support. And poor means you really need pretty much 24/7 care. so more institutional kinds of settings. And here we go. Here's some of the first outcome studies, and I'm cherry picking from Pat Hallen's chapter from 1956 to 1974, and here's the date of the study. And you can see the percent of good, fair, and poor, and you can see poor outcome, 65, 70% of people as adults are ending up in very structured residential type settings. And here, 1989 to 2003. And keep in mind this is a complicated business because we're changing our criteria, we're changing our interventions, we're doing all kinds of stuff, we're mandating services. But look at the number of good relative to the number of poor. It's come up. And there's good reason to think that this is a real thing. It's a complicated business, but it seems to be a real thing. And this is great in terms of what we can tell parents now about what may happen to their child. We think probably we're doing better because of earlier diagnosis. We also are now starting to think about very young children, and that's a real interesting challenge, and Dr. Klenn and some other people are going to be talking about this. We're going to have a whole talk on infants with autism. We do think that there are important variables both in terms of child and program. We're understanding more about what some of this is about, and I'm going to try to illustrate that. This is a very simple but effective model for thinking about what is going on in terms of intervention. Autism is a disorder that has a negative impact on development. When Dr. Klenn shows you some of the eye tracking work, one of the take-home messages is in the social affective realm, children with autism may get perhaps 10% of the information the rest of you are getting in the ongoing transaction. They're getting a fraction of what's going on. When you think about going into a first grade classroom where you're expected to sit in a seat, pay attention to a teacher, focus on what she wants you to focus on, that's a pretty sophisticated load of information that you're expecting a kid to take on board. So you can see for a child with autism for whom the light switch or the light fixtures or the sound of the air conditioner or the blinds or the mechanics of the slides, that might be much more compelling than me sitting up here talking. Whereas all of you are alternating your attention between what I'm saying, you're looking at the slides, you're going back and forth seamlessly. It's a much easier job for you than if you're pulled to the clock on the wall or the light switch or the ceiling. So autism is a disorder that has a negative impact on development by causing trouble in terms of information processing. On the other hand, development happens. Children with autism change over time, they grow and develop. So here is the summary. This is what we want to do in terms of intervention. We want to try to minimize as much as we can the negative impact that autism may have on learning. And we want to maximize the effect that we can push in terms of normal developmental processes. And so that's it in a nutshell. In a sense, if you get that, you've gotten the lecture. I want to say a little bit about terms because we're going to talk a little bit about the kinds of treatments. There are different kinds of programs, and I'm going to show you a summary in just a second. Center-based programs, you take your child to a center like Benhaven School. Home-based programs, somebody may come into the home and help the mother or father work with the child in the home. There may be programs in the public schools. We also have some states that have statewide programs. North Carolina, one of the first, Delaware have statewide programs. So there's a whole continuum of services. There are also some age-related issues. In the United States, and again, we'll talk more about this when we talk about mandates for intervention, there's a separate system for children under 3. Schools are mandated to start services at 3. So that age 3 is a big dividing line. Also, you'll hear about different kinds of methods. Applied behavior analysis, ABA, behavioral methods tend to predominate, but they're not the only kinds of treatment approaches. Things like discrete trial, pivotal response, and we're going to have a whole lecture on behavioral intervention. Other approaches use more developmental methods. A developmental method might be, for example, the child comes into the classroom and the teacher's agenda for the day is they're going to learn about, well, let's say colors, red and green. And they're going to sit and work on red and green versus yellow and blue and whatever. Let's say that, if you're a very behavioral person, you might focus very much on that. A developmental person, on the other hand, the child may come in having seen a red fire truck and may be saying fire truck. You might reorient your whole lesson around fire trucks and transportation and teach colors in that regard. So again, and these approaches are not necessarily incompatible, and many approaches combine aspects of both, so-called eclectic programs. And as you heard, we need to move from having an evaluation to having an intervention plan. The intervention plan that we're going to talk more about later in the semester is the IEP. It's an individualized educational plan for that individual student. And there's lots of ways this can get screwed up, and you can see everything. I think it was Buddha who said if you only lived long enough and stayed in one place, you can see everything, and it's true. You can see kids who have wonderful plans and the plan in practice is dreadful, and the vice versa. That's not usually the case. I've seen plans that were way too short. I've seen one plan that was 100 pages, single-spaced, and I said, who in the world did this? So that you can see everything. But again, to know there's a lot of potential for gaps between getting the assessment and doing intervention. This is probably the most important book to know about if you're interested in terms of intervention programs. It's called Educating Children with Autism. It's from the National Research Council. The National Research Council got a group of talking heads together, of whom I was one, and they put together a report on, are intervention programs for young children with autism effective? That's a question. And the answer was yes. And so this report summarizes all the programs in the country, and again, it's in that chapter in the book. I'm going to show you a slide in a second that looks at some of these programs. It looks at all the programs in the country that have some data to show that they work. And this is the focus is on preschool and young school-age children. They note the many commonalities and a few areas of difference between these programs. They also mention that not every child gets better, although as a group it looks like with earlier diagnosis, kids are doing better and better. It's interesting, these programs all have some degree of university affiliation, which is not necessarily surprising, since that's where research gets done in this country. Let me also say that in summary, and this is a very funny number, because we're talking about very different programs, some school-based, some center-based, some home-based, about on average, in a funny kind of a way, it's a funny number, about 25 hours a week year-round seems to make a difference. Again, the kinds of things that you look at in terms of intervention programs, they should be planned and intensive. They use curricula developed for children with autism. They're interdisciplinary because, again, the child's going to have many different needs, occupational therapy needs, sensory needs, speech and language needs, behavioral needs, maybe medical issues. Teachers have to have experience, training. Families are important in this. And why are families important? Because of the generalization. When Dr. Tsanis mentioned the problem with adaptive behavior, we literally have a young man who's a math genius who solves equations in his head all the time. He has a favorite kind of equation. He cannot walk into McDonald's and get cheeseburger and change. And why is that? Because he can do the math. The cheeseburger is 99 cents. He gives $1, you get a penny. But there'll be a young lady behind McDonald's counter in her perky McDonald's uniform. And she will, before he can get out, cheeseburger please, she will say to him something like, would you like to try our chicken fajita special? And he doesn't know what to do. Because he's not going in for a chicken fajita special, he's going in for a cheeseburger. And maybe they've run out of cheeseburgers, or maybe if he buys the chicken fajita special, she'll be his girlfriend and he would love to have a girlfriend. And so he just kind of collapses. The nice thing about family involvement is they help kids learn to generalize skills, so it's not just learned in isolation. The tendency to kind of learn with blinders on is a real danger in autism. Having child really engaged is essential, looking at behavioral issues and thinking especially about the behaviors that both facilitate and interfere with learning. And finally, thinking about transitions of all kinds, from junior high to high school, from preschool to school age, from high school to adult, college, vocational, all these transitions. Transitions are hard for people in the autism spectrum, and transitions in school program are especially hard. This, and again, this is directly taken out of the book, but this is a summary of those 10 programs. This is the first 5, and you can see here the name of the program, the mean age at entry, the hours per week, the usual kind of method, the approach they take in terms of teaching. And again, the rest of the programs, and again, there's the exact table on page 122. But you can see various different approaches and a combination of approaches. So early intervention seems to be very important, having planned intensive intervention, teaching specific skills, having kids really involved, at least for younger children, on balance about 25 hours a week seems to be the important thing. The kinds of things that the programs work on are very similar. Social skills, communication, play, and remember this is a younger cohort we're talking about for this report. Play skills are important. Play is fast. Play is social. Play has got a lot of cognitive shifting back and forth. You know, I've got a cup. Well, the cup can be a bathtub. It can be a rocket ship. It can be a ray gun. And it's the same cup. And you can see how confusing that would be for a person with autism. No, it's a cup. Well, but it's whatever we choose it to be, and it's very fast-paced. Organizational issues and learning to learn. This is related to the behavioral problem. If you're focused and paying attention, if you can share a focus with the adult, you're going to have a chance to have the adult convey to you some information. If you're scattered and disorganized, it's going to be a problem. And then finally, that generalization piece. And again, we want to typically, as we move into public school settings, think about what can we do to help the child fit in the public school setting and learn. So recognizing how complicated environments are difficult, having a balance between small group teaching, which is more intensively focused, and bigger settings, paying attention to the classroom environment. Don't, for example, set the child where he's looking out the window and can watch all this stuff going on. Put the child towards the front where the teacher can keep an eye. Think about modifications for the environment. If the child has trouble, marking out on the floor, this is your area. This is you stay within this area. Having continuity and consistency, having flexibility, and having good school-home communication, all important. Social skills, there are different approaches to teaching social skills. Especially with preschool children, there's a very nice body of work showing exposure to typical peers with a little bit of preparation on the part of the typical peer can have tremendous payoffs in terms of teaching social skills. There are some good curricula that are talked about in the book, things like the stay, play, and talk with your buddy. It's not a very complicated direction. You know, I want you to stay with Jimmy today, I want you to play with him, I want you to talk with him for recess. You know, kids can get that. And again, but it needs a little bit of preparation and can have tremendous payoff. And there's probably the most extensive body of work in terms of social skills intervention has been done with preschoolers. As kids get older, there are some more challenges. Often as kids get older, we move away a little bit from peers and talking about more social skills groups. Often there'll be a combination of an adult who's leading the group and kids in the group, sometimes including normal peers, typical peers, sometimes not. As people get really older, adolescents and adults, unfortunately their social skills, typically they're left in the dust compared to the typical peers. So remember, as Dr. Tatsana showed you that slide of the 12-year-olds who've got verbal IQs of around 12 years, but their social skills are around 2 years. That's going to be a real challenge having them with other 12-year-olds. Not that it's impossible, but it's often for that group that you have adult instruction. And adult instruction can be very helpful throughout the lifespan. Things like what you do and don't talk to ladies about, right? It turns out there's a long list of things you don't talk to ladies about, right? Well, that's important to know. And you know, for some kids, writing it down, having a list of, I do not talk to ladies about certain body parts. We have one young man whose thing was he likes ladies, and he would admire their breasts. And he would come up to ladies and say, oh, that's a nice set of breasts you have. And he's learned with help to say, you have nice lungs. Now, his parents know what that means, but it's very adaptive. It doesn't get him into trouble. So again, it's interesting, it's a problem. Most of the research has been done with younger children, unfortunately. There are more and more programs of social skills intervention, and we'll talk more about them. Again, they vary a lot, but mostly with adults we're talking, and adolescents we're talking about adult-mediated teaching. And for those of you working at Chapel Haven, you'll have a lot of examples of this. Language and communication is one of the things that predicts outcome in autism. Having some language by age 5 is a good sign. We now think that probably about 75% of preschoolers with autism can develop useful speech. That number used to be 50%. So it's again another indicator that things are going on. Augmentative communication approaches, we're going to have a whole lecture on communication. Augmentative is using other kinds of aids, visual things, photographs. Those of you at Benhaven, you may see a whole schedule for the child in pictures. Again, if you have trouble with language, but if you can understand the pictures, that can help you sequence. You can even do things. You can have the schedule in the fridge, and the parents at home. You can turn the pictures over as the child finishes, so he can have, or she can have a sense of what's happened, what's happening in the future, what's happened in the past. There's a whole technology of this we'll talk somewhat about later on. Manual sign would be another example of this. Manual signing there was tremendous. This would be like the deaf, for example. The problem with manual signing, although there's tremendous interest, and it's still useful for some children, the trouble is it's also fast-paced, and it's transient. The beauty of the static visual thing is you can go back to Egypt and see some of the things written in the hieroglyphs of the pyramids, right? Same thing as 3,000 years ago. Whereas the manual sign moves right along. So the visual strategies are important. We'll have a chance to talk about that. It sometimes is worrisome for parents. They say, oh, if you're using visuals, that means my child will never talk or will never be able to talk. In fact, we think, if anything, that there's probably a good potential. Anything that will help the child learn to communicate will help the child talk. And again, this can take the form of communication with computers, very simple things with pictures. There's a whole range of things that you can put into play. There are some differences in terms of the ways programs teach. So the applied behavior analysis, there's a whole technology we're going to talk about in terms of behavioral interventions. There are more developmental approaches. The kinds of things that we need to work on also in kind of real life skills. So articulation and prosody. We'll talk a little about this later on with Rhea Paul. Kathy Tatsanis was mentioning the difficulties with prosody, and I was giving an example of the man who talks in a very loud monotonic voice. That's a problem when that's the only voice you got. Most of us probably have 1,000 voices. I have 2 dogs. I talk differently than the 2 dogs. Now, admittedly, one of them is deaf, which is a challenge. But when you think of it, you know, you have hundreds, if not thousands of voices, right? So the gift we can try to do with more able people with autism is teach them 3. Soft, medium, and loud, and which one goes where. So church is a soft voice. Recess can be your loud voice. School classroom can be your medium voice. So there are a lot of practical things, and we'll talk with Rhea about speech pathology. Lots of things that we can actually do. Conversational skills, what you can and can't talk about, how you have to give the person a turn, how you have to help them pay attention to what the good nonverbal cues are. If the person's turned and walking away, they probably are not having a conversation with you, right? What are the things you can't talk about? And again, there are endless examples. If you work with more able children, you have wonderful examples. Did I tell you about the kid who talked to me about John Kerry? So we had a child who came in to see us for an evaluation. His mother was in the news business, and he looked at me and said, "You look like John Kerry, but you're too fat." Well, it's that kind of thing that, you know, it's not going to win him points with most people. So it's that kind of thing that we need to work on. Mainstreaming. The presumption under the law is children should be mainstream. They should be with typical children as much as possible. It's what the lawyers call a rebuttable presumption, which means if you can show it doesn't work, you don't have to. And there's a whole interesting discussion about mainstreaming. Some people wanting to advocate it as a matter of right. Everybody has a right to be mainstreamed. You have to mainstream. Some people say, well, you know, let's pick our setting. The most common problems with mainstreaming are people pick settings in mainstreaming where they have the child with the least amount of adult supervision. So the 3 worst places to mainstream are also the 3 most common: recess, cafeteria, and gym. Our kids often do better being mainstream for the more academic things and then put into special places, get their special services in those less structured times. Play skills we talked about. Again, there's a whole body of work looking at teaching play and leisure skills. This becomes very important because it's also a foundation for having social interaction skills. We're going to have a whole set of talks later on in the semester, including one from Michael Powers about behavioral issues. You have to have a vision of what you want as well as what you don't want. And that's important. Because you can see, oh, this is bad. Hand flapping, you know, body rocking, stereotype movements. But then what are you going to put in its place? And so you have to look at both. And again, there's a wonderful technology on this. This has made a tremendous difference for children, especially children who really need this kind of more intensive behavioral work. Organizational skills, and this comes for the more able as well as the less able child. Lists, organizers, schedules, software assistive devices, having something like an iPhone or something you can have, you can call up, you can see what's coming next. That can be great. There's some wonderful new apps actually for the iPhone that have been developed for kids with autism. Fantastic. Thinking about software, thinking about, even for lower functioning kids, simple assistive devices. So 2 quick examples. We had one young man, I'm going to say probably in the 4th grade, he had to do a paper on Egypt. This was a more able kid with Aspergers. His thing is he gets 1,000 facts on Egypt, but he can't write a paper. All he's got is 1,000 facts. So I told his father to go to PowerPoint, have 4 slides. The first slide is Egypt History by Joe Blow, not the kid's name. The next, the title is Egypt at the time of the Pharaohs. The next, Egypt at the time of Muhammad. The next, Egypt today. Then the child goes put some of the factoids in, along with a few of the pictures, and then you click on Outline. So you've gone from a visual to a written, and then you fill in the blanks, and you got a paper. So sort of simple things like that. For example, with daily life, shopping. Shopping is a real problem. We have a lady who actually lives in my town in Brantford who worked with our speech pathologist. She has a 6-year-old boy with autism. He's very disorganized, and he's a handful when he goes to the grocery store. The speech pathologist and the mother put together a visual shopping list for this boy. So it's got a picture, he's got a clipboard, and he's got a set of pictures, and it's organized aisle by aisle sequentially in the store, and he's pushing a cart. This turns out to be a very sophisticated behavioral thing, because if he's pushing the cart, he can't get into trouble. And he's looking out for spaghetti sauce, because that's his favorite thing to do, is to eat spaghetti. And so he's looking for, cans of spaghetti sauce. There's 2 cans. And he gets them, crosses them off, puts them in the cart. This is a nonverbal boy. He's going on, he's getting the spaghetti. He goes on, he gets the whole business. He goes to the line, he checks out, he goes home, he has a rest, then he cooks spaghetti. He has an index card with a recipe, 50 cards to cook spaghetti. The first one, he's got a picture of him eating spaghetti. Turn the page on a little keychain so it's sequential. Get the pot. Get the pot, here's the pot. Next page, water in the pot. He sees water in the pot. Pot on the stove. And again, he can now cook. For him, it's been very functional. He can shop and he can cook. And that's great, and it's much more than he could have done otherwise. Adaptive skills, we've talked about the difficulty with learning things in generalization. Our kids often learn like they've got blinders on, and you'll come up with this, and we'll have some examples, I'm sure, as we talk about this. Occupational physical therapy can be very helpful in terms of dealing with some of the sensory issues. The sensory issues in autism are interesting. They're very striking, and you'll see some children, for example, a little something, the shirt will bother them. It'll just drive them crazy, or some sound will bother them. One of the problems is when we've looked, the sensory issues, although they certainly are seen in autism, and they can be very important in terms of dealing with them, when it's not so clear that they're the kind of primary thing. They may really fall out from some of the social vulnerabilities. That's not to say they're unimportant. One of the problems has been often in terms of dealing with some of the sensory issues and sensitivities, there's probably less in this area of a good, solid research base than some of the other areas. But there are some interventions, and there's more and more that people are starting to look at. Thinking about gross and fine motor problems, kids with Aspergers, the more able kids who are very verbal but socially disabled, often have significant motor problems. And this causes horrible trouble when they get to the 3rd grade, they need to write cursive. And I've had some interesting discussions with schools over the years, and there's ways around this. One of them is a laptop. I mean, I could write something down for you, you wouldn't be able to decipher it. I wouldn't be able to decipher it in 5 minutes. On the other hand, I've written a couple of books. How can I do that? Laptop. So teaching kids to use things like computers, keyboards, it sometimes causes trouble because, I mean, I had one teacher yell at me, "You're giving the kid a crutch, a crutch, a crutch." And I said, yeah, if you didn't have a leg and I gave you a crutch, that would be a good thing. It's not a bad thing to give a person a crutch if they need it. But again, you have to be aware that for some people, these motor things can be really quite dramatic. Sometimes, and especially for the younger children, especially with classical autism, eating and feeding issues. And interestingly, it's not so much nursing issues, it's when solid foods are introduced. There'll be profound likes and dislikes, and it drives people, as parents, especially the mothers, crazy. And there's, again, some ways we can think about working around dealing with that. Speech pathologists can be helpful. The occupational physical therapist can be helpful. Sometimes changing the texture or the temperature of the food. I've had kids that would never eat mashed potatoes if their life depended on it, but you make those mashed potatoes cold, put a little vanilla and some chocolate sprinkles on top, it's perfectly fine. So interesting areas of sensitivity and vulnerability. If you were to take, and in fact there's a whole table in the book, what we know in autism about troubles, and then how would you deal with the troubles? So if you've got problems in an organization, what would you do? You would be stepwise, you would be consistent, you would use routines, you would use visual aids, you would give plenty of time. If you have attentional problems, what would you do? You would isolate the relevant information, set the environment up to help the kid focus on what's most important, support the child's attention in any way you can. If you have trouble with sequencing, what would you do? You would give visual cues, have predictability and consistency. Kids with autism tend to learn things in whole chunks. In some funny way, this is exemplified by their tendency to echo. So the child learns a whole phrase and that sort of stands for something. It can be very idiosyncratic and very unusual. So how can we help kids with echoing? Well, and this sort of tendency to learn things in chunk, generalized by going across settings, helping the kid learn to break things down. In fact, one of the positive things for kids who only echo, when we start to see them break up their echoing, what's called mitigated echoing. So it breaks up a little bit. That's a sign for us that the child is starting to learn the individual words as opposed to the whole chunk. If you have a visual learning style, what would you do? Use visual supports, limit verbal language, keep language short and simple. One of the most common problems, and you'll see this more probably at Ben Haven, a little less at Chapel Haven, but maybe at both. Often when kids are starting to have behavioral troubles, our natural tendency is to get to be polite. And polite is fine in most contexts, but often when we get polite, our language gets very sophisticated. We start to use the subjunctive. Remember the subjunctive? Would you, could you, might you? Jimmy, might you feel better? Wrong way to go. Jimmy, stop. Jimmy, do this. Jimmy, right? And it's a common problem that we tend to forget the visual learning style. In the attempt to be polite, we end up actually doing the child a disservice because they have trouble attending. And lastly, time and temporal sequences, visual support, concrete instructions, adequate time, expectations, outcome, and feedback. If I were to give one of you a little cloth rag and say, could you clean that table? And you would clean the table, you'd be done, you'd look at me. A person with autism might keep cleaning and cleaning and cleaning and cleaning. And why is that? There's not a start and a finish line. So what would you do? You would adopt a strategery, as our former president would say. You would start at one corner and you work it to the bottom. Let's stop at top left and work until you get to the bottom right, and you're all done. That would be a very effective strategy because they would then have a sequence that they could use. Trouble understanding social cues. You have to turn yourself into a life insurance or a car salesman. You want to be enthusiastic. Make it big. Make it bold. Right? Subtle? No. Subtle will be lost. So exaggerate. Keep things slow. Keep, again, explicit teaching. And again, we'll have chances to talk. Once you've had a chance to go out and work with some of the children, we'll have a chance to talk about what your experience has been. Explicit, explicit, explicit. Issues in mainstreaming, we've talked about this in terms of it's a rebuttable presumption. Looking at peers, especially if they have some training, can be fantastically helpful. And I mentioned the 3 worst places to mainstream. The developmental approaches look at how kids typically learn things, and that's a starting off point. Kids with autism spectrum disorders sometimes violate this. I have one young man who's now a very high-functioning man. He's actually written his autobiography. But when he was literally here at the Child Study Center years ago in the nursery school, he didn't talk until he was 4. And then he talked in full sentences. He skipped that single word, the phrase stage. He started talking in full sentences about an event that had happened the year before. That's not a typical pattern developmentally. So even though we're prepared developmentally for kids to follow sequences, we have to know that sometimes they violate them. As much as we can, we want to pay attention to the child's preferences and motivations, and we also want to pay attention to the learning environment. Having an environment that's very complicated, distracting for the child, is not going to be so helpful. The more able kids, these are the very bright kids. Sometimes people say, oh no, he can't have autism or autism spectrum, he's too bright, he's too verbal. There's tremendous variability in their presentation. One of the worst things that happens is the kids can get labeled as having behavioral problems. And there's a whole lingo on this, SEM, SED, ED, BD. This means bad boys. Social emotionally maladjusted, social emotionally disturbed, behavior disturbed, emotionally disturbed. So they take a kid who's socially clueless and put him in a class with kids who are really bad boys. And then literally all hell breaks loose. I mean, I've had the experience of having a kid, a 6-year-old with Aspergers, go into a class, quote unquote bad boys. He's there for 5 minutes. The child says, hey, Jimmy, see that red box? Go over and pull that red box, see what happens. And he will, because he's clueless. Very quickly, we're going to talk a little bit about Asperger's. We'll have a chance to talk more about this. You heard a little bit from Dr. Tsanis. We want to use verbal strategies. Verbal strategies are actually helpful. Being very explicit. Teaching things explicitly. How come you're feeling not, how do you know how you're feeling? You're feeling depressed, how does that feel? Feeling anxious, how does that feel? Making things explicit. Often these are children who have blow-ups, but they haven't paid attention to all the steps that lead up to the blow-ups. And those of you at Chapel Haven will have a chance to talk about this. Again, we can teach with kids with Asperger's verbal scripts. Oh, I have to remember I cannot talk to people about deep fat fryers unless I've given them a chance to talk first. Or whatever it is. But again, kids with Asperger's, because they have this verbal ability, they can use these steps and they can practice in their head. Teaching explicit rules, teaching things like self-correction. Am I talking too much? Is this more than you want to know about deep fat fryers? Would you like a turn now? All these are kind of sort of stilted mechanisms, but at least they get the child feedback. Academic curriculum, and we're moving towards the end. We don't want to lose sight of the big picture. We want to emphasize the child's strengths. My usual joke is it's easy to make the kid feel bad. What we want to do is help him feel good about something. So we want to think about ways that we can actually use the child's special interest whenever we can. This comes up especially with kids with Asperger's, and I think my next slide shows an example of that. Yes. So this is a young man who's had an interest in snakes all his life. This is a kid with Asperger's. The first time I met him across the hall, He actually had seen our colleague Wendy Marins, who's a speech pathologist, and he had talked to her about the dreaded puff adder of England, because she's from England. And then he saw my colleague Ami Klin, who's from Brazil, and he talked to him about the dreaded giant anaconda. And then I walked into the room, and his first comment was, "Thank God at last an American." And then he talked to me about the dreaded pygmy rattlesnake of upstate northwestern Connecticut, right? So he's got to think about snakes. So this kid comes to the 7th grade in his little town in upstate Connecticut, and he's got to write a thing on the Battle of Gettysburg, and there are rules. He's got to have a picture of the general, he's got to have a map, he's got to have something about the battle. And so the teacher and the mother and I were having this whole discussion about this problem, and the teacher said, "Oh, if we could only bring snakes into the Battle of Gettysburg." I said, "Oh, what a fantastic idea." So this was part of his poster, which I mocked up. And he's got, you know, there's Robert E. Lee, and there's where Robert E. Lee is. Here's the picture of the battle, there's the map. And here, of course, is Gistrodon piscivorus, the dreaded water moccasin, which is what he's really interested in. But he's learned a lot about the battle, even in the context with the snakes. So when you can find ways to do this, it can be very adaptive. It can sometimes be a real challenge. But when you can make it works very well. So again, we want to have, especially for the child who's more cognitively able, kids with Asperger's, but also with autism, sometimes people forget the speech pathologist. And they say, "Oh, but he's got such a wonderful vocabulary." Yes, but he can't carry on a conversation. And that's something, again, for those of you at Chapel Haven, we'll have a chance to talk about, because it'll be a very interesting experience. People will be talking at you, but not with you. And again, I think having one of the simplest things that schools can do is having a safe address for the child. Having somebody that when the going gets tough, the child can raise his hand and say, "I need a pass to go see Mr. Bob." And off he goes to see Mr. Bob. He has to come right back. It can't be getting out of something. But the beauty of that is it disrupts the problem behavior before it starts. It helps the kid be more reflective. It gets an adult involved who can go back to say to the teacher, "Hey, how come Jimmy was having trouble today?" And it's a very cost-effective intervention. And again, we'll have a chance to talk about that over time. As we're getting back to the very, very end, things that you can do, and we'll have a chance to talk about this, working on conversations, what you can and can't talk about. How do you modulate your voice? I have some people who will say things like, "Am I modulating enough?" But again, the fact that they're paying attention is a plus. Encouraging self-monitoring. You can use video, audio tape. You can work on these things. Now, one of the problems is we do a better job of teaching kids about responding. Initiating is really hard. And one of the things you will discover, and especially, actually in both contexts, how kids come up and approach you can be very idiosyncratic and one-sided. And it's really hard to intervene at that level. But again, we'll have a chance to talk about that. And finally, for the more able kids, keep in mind that what seems like maladaptive behavior, and indeed it may be very maladaptive, but it has to be understood in context. And the question is, why is the child acting this way? One of my great examples, and I'll end on this, I think, very shortly, is a child from another town, upstate Connecticut, who was a kid with Asperger's, so he's verbal, but he's motorically challenged. And the town's done a great job of getting services for this child. He's got an adaptive PE teacher. She's a wonderful lady. She's got 3 or 4 kids in the class. One day she is sick, and it's a small district, and so who do they get in to cover her class? The football coach, because he's not doing anything in the morning, right? So you get this big guy who lumbers in and doesn't know much about little kids, and they're supposed to run the 50-yard dash or some silly dash. And the idea is they have a stopwatch around their neck, and they're supposed to, push a button and run to the other, and stop and call out their time to the coach. Well, this poor kid, who's, he's all of a sudden, he's discombobulated anyway. It's a new person. It's a somewhat scary person. He's given him all these instructions, and this coordination business is a bit of a problem. So he starts to run, and he stops because he's forgotten to push the button. And so he stops, and he's trying to explain to the coach what's going on, and the coach does something that, even in retrospect, the coach himself said was a mistake. The coach says, "Hey, dummy, why'd you stop?" Really helpful, right? So the kid takes off the watch, breaks it on the ground. The coach, who's really upset, hauls him off to the principal's office because no child left behind. We've got to kick him out of school. He's broken school property. And I explained to the coach later, I said, "Geez, you're lucky. If I were the kid, I would have hit you." I said, "You should have praised the kid." And so we had this whole discussion, and it was interesting because he got it. And he understood what the troubles were, that he wasn't accommodating a kid with special needs. But it's that kind of thing that causes trouble. And the more you work with this population, you're aware of the tremendous potential, because most of us will generalize from one setting to another. Here, it can be a real challenge. And finally, vocational issues. Thinking about how do you work on getting a job, teaching grooming. We had one young man who wanted a job. He loved sports. He knew all about sports. We arranged for him to interview with somebody from a local paper to be a sports fact checker. And so we got the guy, the reporter, and this kid together, and the kid talked about, he knows everything. Michael Jordan's best year, what are his stats? And at the end, the kid left the room. We said to the reporter, hey, what do you think? The reporter says, I've never seen anybody who knew so much about sports facts. It's a shame he doesn't want the job. I said, how come you think that? He never once looked at me. So we've learned that one of the things we do is we teach people at the beginning, at the end, and somewhere in the middle, you got to make eye contact. So again, it sounds kind of dorky, but it's actually very effective. So you have to work on all these things. We'll have a chance to talk, and for those of you, especially at Chapel Haven, with more and more kids going to college now, which is fantastic, there are other challenges. You may not appreciate it, but the ability to go to college is remarkable. You're out there, you're on your own, you're negotiating with your peers, you're negotiating with professors, you're doing all this stuff. And for many of our kids, it's a real challenge because academically they can do it. But it's all this other stuff that goes along, and that's one of the beauties of a place like Chapel Haven. And family involvement. This is where we stop. Again, we have to have families involved. The families are there when we've come and gone. The family will be there for the long haul. The family are going to be involved, including parents and siblings. And we'll have a chance to talk over the course of the semester about that. And we'll have Allison Singer will come in and talk about her perspective as a family member.